Ladies and gentlemen, dear viewers, on behalf of the Supreme Committee, it gives me great pleasure to welcome you all again to our press conference. And of course, today is Monday, and usually we used to have it on Thursday, but for reasons which I may explain during these few coming minutes, the Supreme Committee felt that there are changes that are happening very fast, and we need to make you aware, we need to have you informed, which I'm sure most of you are very informed about what's happening. And as usual, I'd like to start with numbers. Worldwide, the confirmed cases up till this morning, 103 million, the confirmed cases again, 103,533,536 cases. The death, those who died from COVID-19 confirmed, 2,237,813, and the number unfortunately increasing worldwide. In Oman, yesterday we registered 198 confirmed cases. That took our total to 134,524. Up till yesterday also, we did 1,555 tests. Those who recovered are 126,949, and that's around 95%. Unfortunately, there were 2 deaths yesterday, which took the total to 1,532. Those who were admitted yesterday to our healthcare facilities are 11, which took the total to 92. 2 admissions were to the intensive care units, and the total patients in intensive care units up till this morning, 22. We received so far vaccines. We received from Pfizer 39,672 doses. We vaccinated a total of 27,400. And those who received the second dose are 12,272. And I need to let everybody know, those who received the first dose, there has been a delay in the second dose. The reason beyond our control or the company's control actually as well. They have a problem with production because they were enlarging their factory, but we were assured that the next consignment will be here before the middle of this month. That's firstly. Secondly, scientifically, the delay for 6 weeks or even up to 8 weeks will not affect the efficacy of the vaccine. Therefore, please do not panic. You received your first dose. The second dose will be given to you on the time and when the vaccine became available. Also, I would like to acknowledge and thank the government of India and the people of India for the gift we received yesterday from them, which was 100,000 doses of AstraZeneca vaccine, which was made at the Indian Serum Institute, which is the largest vaccine factory worldwide. We appreciate this gesture, and we are going to start using this vaccine very soon. I need also here to mention that we cannot give the second dose for those who received Pfizer vaccine from a different company. It has to be from the same company. Let me go back to the numbers now and why this press conference today. On the 21st of January, we had 51 patients admitted. Total admission, the inpatient in Oman were 51 patients only. And from the middle of October, our numbers were going down nicely and smoothly. The ICU total number dropped from 220 to 20 cases. The admission dropped from over 576 to 51, as I said. But within 10 days, on the 31st of January this year, the total number of patients admitted in Oman reached 202, i.e. doubled in 10 days. That's alarming, that's worrying, and scary to all of us. I've said it several times, none of us want us to go back to where we were a few months ago. Those who are working in healthcare and the supporting services, they've been through a lot. I've mentioned that some of them didn't see their families for 6 months. I've mentioned some of them were working 18 hours non-stop. But thanks to all of you for following and adhering to the measures that protect us from this virus, and you all know it, and I will repeat it several times. I'm not shy, I'm not bored of repeating it, because obviously some people didn't get the message. Wearing the mask appropriately, where needed, is one of the most important weapons we have against this virus. Keeping your physical distance, avoiding gathering. The number went up, and we are all aware about the new strains worldwide. And I'm sure you are following what's happening in many countries which went back to complete lockdown. You've heard what France did yesterday. They announced yesterday they will not allow anybody from outside the European Union to enter that country. I think this is all an indication of how worrying this virus is. It is still spreading, and the new strains, you've all heard it as well. They spread faster than the original one, and they might be more deadly. The Prime Minister of the United Kingdom, in one of his press conferences, mentioned that the death rate is higher. And we know automatically the number of cases increases, automatically the number of admission will increase, and then the number of deaths also will go up. It's all in our hands. We have choices, and we have to make the right choice, the right one. We have choices to continue doing what we know will protect us, our family, and our community. And that's luckily what most of you have been doing, and I'm grateful, and the Supreme Committee are grateful to all of you for doing it. That's the majority. But unfortunately, the other choice, which seemed to be adopted by the minority, is to ignore all this and behave as if there is no pandemic, behave as if the virus has disappeared, has vanished. You all see the images of these tents, which are full of people hugging and kissing and shaking hands. Forget about wearing masks. You all see the gathering on the beaches. You've been to restaurants where the adherence to the minimum required is not there. The Supreme Committee met last week, and there were some decisions taken which reversed previous decision, and we stopped certain functions and activities. We don't want to go back to even partial lockdown. But your health, your life, your protection is the priority of His Majesty's government. And the virus is still here. The vaccines are not going to be available to everybody in any country for a long time. And as I've mentioned in Arabic, and probably I said it in English, the vaccine will protect you from having the disease, or at least the severe disease, but it will not stop you from carrying the virus as yet, which you could spread to others. So unfortunately, going back to normal is not feasible yet. We are still, as you can witness and see worldwide, still struggling to control this pandemic. And with the new strains, and as yet, I need to be very transparent and frank, the new strains, as yet, they respond to the vaccines that are available. They respond to the same supportive measures of treatment that are available. But we don't know what would happen with the next strains. And the longer a virus circulates in the community, the more likely, and I've got an expert here, Dr. Ahmed, so I'm probably out of my depth, but I've learned a lot about viruses over the last year, the more likely there'll be new mutation, new strains, which might be resistant to the vaccine. They might be more deadly. Luckily also, to be frank and transparent, some of the mutations are not in the interest of the virus. It's the opposite, but we cannot count on that. Again, we have choices, and we all know what is the right choice, what is the wrong choice. The technical team yesterday were discussing the option of closing Oman airports. Does anybody honestly want us to go back to that situation again? I don't think so. We need to protect ourselves and the community so that the Supreme Committee will not be forced to take decisions which are detrimental and harmful to the majority who are doing the right thing. Some of the stories that reached us are, honestly, I don't know even how to describe those who are doing it. Some people will, after they are given this bracelet to monitor their quarantine status, they reach their houses and they either remove it and leave it on a table somewhere, or make some of their staff wearing it, or some of their elder. Who behaves this way, honestly? I said it in Arabic. I don't have any phrases or names to describe them. I'm just hoping that these are the very small minorities, and if they are listening, I hope they will never do it. Also, because we didn't have any decision from the Supreme Committee previously, for those who don't return the bracelets, people were throwing them in the street. Now, anybody who is provided with a bracelet at any entry to the country, whether it's airports, ports, or land borders, if they don't return it on time, the fine is 1,000 Omani riyal. Firstly. Secondly, what we said in Arabic, that the quarantine is for 7 days, under one condition: on the 8th day, you do the test and it's negative. Unfortunately, some people used to think there's an option that I'll stay for 14 days, which they didn't. And some of them, they had symptoms, and they went and mixed with others. So it's not over. We wish it was. And the suffering and the misery that many people have been through could have been avoided. We couldn't believe that, alhamdulillah, our healthcare facilities, most of them went back to serve the people who need them most when our numbers dropped. Our outpatient clinics went back, some of them to 100% capacity, our operating theaters, and we were hoping that that trend will continue. But again, some people, unfortunately, thought that they are immune. They thought that the virus is harmless to them. It might be if you are young. And here, I urge and ask our younger population, and they are the majority, to be part of the team which is compacting this virus, to be part of the awareness, spreading the awareness. And also, I urge all of you to report every violation you could see from anybody. We cannot, and nobody wants to have a police officer at every restaurant, every shopping mall, every beach. You are the police. Every one of us should be a police here. Every person. Unfortunately, if we don't have it in ourselves, to protect ourselves, to protect the community, I don't think anybody else could do it. We cannot have 24/7 monitoring and watching for everybody. No country can or want to do that. But we always count on you. Count on your sense of responsibility. Count on you actually feeling that you have to protect your loved ones and the community, and to protect also the healthcare system, the economy of the country. I wish you all well, and I hope the message is very clear that working together, doing the right thing together, is not going to make the pandemic disappear, but it will definitely reduce the impact locally and hopefully regionally and internationally. Regarding the vaccine, I've mentioned how much we received so far, and the technical team at the Ministry of Health, they put priorities like any other countries, and we've managed to vaccinate over 27,000, as I've mentioned. There was a delay, unfortunately, from Pfizer, and we understand that's beyond their control. but we are hoping to start receiving our share from the COVAX facilities, which is Oman is a member with 190 countries, and everybody who is eligible for the vaccination, everybody who is from the priority list from the technical team, we hope to have them vaccinated before this summer. Thank you all.